Now, ladies and gentlemen, please put your hands together for Dr. Peter McCullough. Dr. McCullough, thank you so much for agreeing to present for our community here on Sunshine Coast. Yes, please go ahead with presentation, and thank you on behalf of all Australians.
Well, I'm delighted to join the Sunshine Coast again. You know, I was there about a year ago and met many of you in person. As introduced, I'm Dr. Peter McCullough, a practicing internist and cardiologist, a research epidemiologist in Dallas, Texas. And, you know, I've been a voice regarding what I think is, you know, a rational response to this novel infection and what's transpired with the principles of early treatment and now managing what we're seeing with the vaccine. So let me give you an update on where we are with the infection. We are now 2 years into the Omicron phase of SARS-CoV-2. It started out as the wild type, then alpha, then beta in South Africa, delta in the United States, gamma in Brazil, and then we went to Omicron. Omicron basically broke in December of 2021, and we've been in Omicron. It's the most, far and away, the most mutated and mild version of the virus. You know, by the time COVID got to Australia, it was much milder. It was the Omicron strain that largely hit. Now, the Omicron has substrains, and we've been through many of them. We currently have you know, been through this hyper-dominant, what's called JN1 variant. It may have been the more difficult of all the variants. In the United States, 97% of Americans have already had COVID. They've already had the illness. And what we know, and the same is probably true in Australia, what we know is that once you've already had the illness, the next infection is characteristically very mild. A paper by Chin and colleagues, New England Journal of Medicine, October of 2022, said once you're through Delta or Omicron, the next Omicron infection is associated with zero risk of hospitalization and death. So I think people getting sick today can simply use kind of home management techniques to get through the illness. That's where we are. So natural immunity, the things that prevented hospitalization and death were natural immunity and then early treatment. And in countries, the early treatment was different. But in Australia, your early treatment can be forms of virucidal nasal sprays and washes. I know this because I got sick in Australia. So I went to a pharmacy. You can actually get iodine. You can get very good povidone iodine in any pharmacy in Australia, 7.5%. You just need a drop or two in a spray bottle with some salt water, spray it up your nose, sniff it back, spit it out, gargle with scope or Listerine, a few drops of iodine. You can do that every 4 hours for an acute illness. It's very effective in aborting a common cold, influenza, respiratory syncytial virus, SARS-CoV-2 infection. We know that now published studies show that zinc, vitamin C, vitamin D all play a role. They play a role in treatment as well as prevention. A polyphenol supplement, quercetin, and then we have an over-the-counter drug, famotidine, which is in a sense an available antiviral medication. In Australia, you also have available prescription medications that can help you through the illness. I recognize that hydroxychloroquine and ivermectin weren't available, but you have Paxlovid, molnupiravir, other prescription drugs, prednisolone, montelukast, cyproheptadine, and then, of course, aspirin, blood thinners, colchicine. So there are multi-drug protocols. You go to my website, petermcculloughmd.com, see the McCullough protocol. It's the most widely used protocol in the world or variations of it. But the point is, even elderly people, like this week I had 2 people in their 90s in my office with COVID, and it was their first case, and they were terrified, and we got them through the illness with ease with the McCullough protocol. So any one of you have loved ones that are dear to you, and they get sick with the first, please get them what's available to you in your country. Don't have them go with no treatment. People who get no treatment after a week or two, they end up in the hospital. You lose all control of what's going on. In the vast majority of deaths occurred in the hospital, meaning that if people just were simply treated at home and we actually used oxygen at home, we don't worry about low oxygen saturations as long as the work of breathing is okay and mentation is okay. Home treatment protocols, far safer, far more comfortable than hospitalization. Turned out, despite all the efforts, masking, social distancing, lockdown, hand sanitizers, they didn't prevent spread of the infection. And in the US, the agencies gave up. The CDC now says the only time we should wear a mask is when we're in hospital respiratory isolation. So when I saw my COVID patients this week in the office, no one was wearing a mask, and we don't worry about it. We simply did the iodine spray and gargle afterwards, and we didn't get sick. So it's perfectly fine to do that. And our government agencies have essentially capitulated. What has not gone away, though, are the complications after the infection. We call it long COVID, and it is a real syndrome. Patients who are sick enough to be hospitalized, about half of them have long COVID. And then even the milder respiratory infections at home, even if they don't have symptoms, they still have risk for complications like blood clots. And I'm very worried about recurrent infections than people presenting with blood clots. We know that what's causing long COVID is that the spine on the surface of the virus, the spike protein gets into the human body, and the human body cannot clear it out. The spike protein was engineered and devised in the Chinese biosecurity lab in Wuhan, China. It's not a natural protein. It's not amenable to proteolysis from natural enzymes. And so we actually have to do something about it. Long COVID is a very real syndrome. The blood clots and neurologic complications after the infection are real. And when someone has acute COVID, there's about a 6-week window where there's a higher risk for myocardial infarction or heart attack, stroke, blood clots. And so for that reason, we have patients take full dose aspirin and make sure they're under close observation. I've seen time and time again, COVID-19 and then provoking a heart attack or a stroke or some serious event. Now enter the vaccines. The COVID-19 vaccines, Pfizer, Moderna, Janssen, and AstraZeneca were for the first time genetic technology transfer programs. So when these were rolled out, we could have had no idea what was really going to happen since they were brand new and genetic. Now, the Novavax vaccine was an antigen-based vaccine, and then Sputnik, then the Sinopharm and the Chinese vaccines were killed virus vaccines. But the genetic vaccines, which is largely what the United States and Australia took, no one could have known what was going to happen. We only had about 3 months of data with Pfizer Moderna program, for instance. So when they rolled out, no one knew what was going to happen at month 4 or 5. So when people said, oh, they're safe and effective, no one could have known that because the data observation period was too short. So that was largely wishful thinking that happened. So when the governments really got onto this and said no jab, no job, and what have you, they could not have known if the vaccines were going to work or not because there was only 3 months of observation from the trials. So the governments, doctors, nurses, the public, they all jumped the gun on this. A much more reasonable stance would be, listen, we don't know if these vaccines are going to work. Let's offer them for high-risk nursing home patients or seniors in congregate living. I sketched this out early on in a U.S. vaccine program. I estimate about 2.7 million Americans out of 330 would actually, have enough risk to potentially benefit from a vaccine. But this mass vaccination globally across Australia was, I think, just an absolute tragedy. It is incredibly misguided. What we've learned is the vaccines, none of them have any theoretical duration of time that is worthy of a vaccine. We're being told to take a vaccine every 6 months. That's unprecedented to have a vaccine not last very long. And then on top of that, there are no randomized prospective double-blind placebo-controlled trials that showed the vaccines reduce the risk of serious infection or reduce severity of infection. They were never shown to reduce transmission, and they were never shown to reduce hospitalization and death. So when people were told, listen, take the vaccine to avoid the hospital, that was a false claim. In the United States, even the consent form doesn't list reductions in hospitalization and death as a benefit. So take a look at the consent form of the vaccine you cite and look at the benefits section. What does it actually say the theoretical benefits are? I think you'll be disappointed. So these were all overstated from the beginning. They were all overstated. People were told to take the vaccine so they couldn't, so they could see their grandparents. That was based on a false claim that they blocked transmission, and they didn't. Our CDC director came out in the summer of 2021, and she said they don't stop transmission. All the mandates should have never occurred, because a mandate would only be if we had a very effective vaccine and then it blocked transmission. They should have never occurred. Yet what happened. Now, in terms of safety, what we're learning in terms of vaccine safety is a bona fide biological product debacle of really unspeakable proportions. This is worse than we could ever have imagined. I'm the only public figure in the world in writing who questioned the vaccines before they came out. And I published an op-ed in The Hill, which is a widely read journal for the House, the Senate, and the White House. And it was in August of 2020, and the title of the op-ed was "The Great Gamble of the COVID-19 Vaccine Program." And boy, was I right. It was a gamble, because the major vaccines were the genetic code for the spike protein. The spike protein is the lethal part of the virus. And there was no assurances or mechanism of what was going to shut off production of the spike protein. No one knew how long the genetic material would last in the body. No one knew how the body would get rid of the spike protein. What would prevent the spike protein from getting into critical organs like the heart, the brain, the adrenal glands? No one knew. It was the most dangerous proposition in all of humanity to mass vaccinate with the genetic code for a lethal protein that was devised in a Chinese biosecurity lab and have that in everyone's bodies. Well, what have we learned? The messenger RNA is at least circulatory in blood for a month, maybe longer. The messenger RNA gets physically stuck in the heart. That's been shown in a paper by Crossan and colleagues from Harvard. It's physically stuck in lymph nodes, shown by Rolkin and colleagues, at least for several months. And the messenger RNA is long-lasting. The Nobel Prize was won by Carrico and Wiseman because they modified messenger RNA to essentially be indestructible. This was such a diabolical alteration in messenger RNA that there were immediate protests across Scandinavia, candlelight vigils, saying that this Nobel Prize was for an invention that is going to cause great harm to humanity, and in fact, it already has. So the messenger RNA cannot be broken down by human ribonucleases. There's never been a study showing us how it gets out of the body. The spike protein that's produced from the messenger RNA is the full-length spike protein. It's much different than the infection. The infection, you get just the outer segment, the S1 segment. The S2 segment is sacrificed at its entry receptor called the ACE2 receptor. So the natural infection gives a small amount of spike protein. The vaccine gives a massive amount of full-length spike protein. And Pfizer and Moderna altered the spike protein code with 2 proline residues to hold the spike protein open. And the spike protein always trimerizes. It actually goes into travel in 3s together. And in a paper that I think has really shocked the world, Brogna and colleagues from Germany have shown that the spike protein is measurable in human blood 6 months after the shot. And that's as long as they've looked. It may be even longer. So you may ask, why do some people feel so sick after they take the vaccines? It's because the spike protein is in their bloodstream, circulating, and the spike protein is known to damage all the vital organs including the heart, the brain, the adrenal glands, the reproductive organs. It causes blood clots. It is the most dangerous protein we've ever seen in human medicine. Now, when I went on Joe Rogan podcast, many of you have watched that program in December of 2021. He asked me probably the best question anybody's ever asked me. Joe asked me, listen, if the vaccines are so bad, how come everybody doesn't die from the vaccine? And I didn't have the answer then, but I do now. What we've learned in a paper by Schmeling and colleagues, as well as from the US CDC data, that not all the vaccine vials are the same. They're not the same. About a third of the batches, there's no side effects, not even a sore arm. And it looks like those people never have any problems, as far as we can tell. Okay, so all of you who took the shot, think about, did you have a sore arm? Did you get sick afterwards or not? If you didn't, chances are you're fine. There's just under 2/3 who take the shots, and they have some minor side effects. They appear to be okay. But in the Schmeling data, it was 4.2% of people who get really sick with the shots. Watch out. They're going to get in trouble later on. Our CDC VSafe data show 7.7% of people get so sick with the shots, they actually have to go to the accident and emergency department, urgent care, or be hospitalized. 7.7%. So the Danish data, 4.2, US, 7.7. Somewhere between 5 and 10% of the population, we are very worried about. What we think is going on is that some of the vials have hyperconcentrated messenger RNA, and people are getting a huge dose. Other people are getting very little amounts of the material. Recent data, 4 labs have shown that the vials have what's called DNA process-related impurities or contaminants. The vaccines in part rely on E. coli. A circle of DNA is inserted into the E. coli, which codes for the messenger RNA, and it uses what's called simian virus 40 or SV40 promoter enhancer and origin insertion segments, as well as antibiotic resistant genes. These DNA fragments should not be in the vials of Pfizer and Moderna, yet 4 labs have shown it. Looks like they're above thresholds of concern for quantity and size. 2 peer-reviewed manuscripts. This is so disturbing that Florida Surgeon General called upon the CDC and FDA to answer for this and inspect the vials. They refused to do so. So our Surgeon General of Florida, our third most populous state, has called for the vaccines to be removed from the market. The DNA issue could be related actually to cancer or oncogenesis. SV40 is a known proto-oncogene activator. And so the great concern here is that with these tainted products, there could be a risk for cancer. And now a paper from University of Oregon has come forward. First author is Anguis, senior author is Bustos. And in there, the name of the paper, the title is called The Multi-Hit Hypothesis for Oncogenesis with COVID-19 Vaccine. So messenger RNA impairs DNA repair. Chinese have shown this. The vaccines have these DNA contaminants, SV40. And now the spike protein produced from it inhibits tumor suppressor systems, P53 and BRCA. So in short, now every single cancer registry in the world is skyrocketing in terms of cases and recurrent cases. The only smoking gun here is the vaccine. The great concern here is people with cancer, at risk for cancer, were told to take these shots. Now it looks like they're going to be in a much worse situation with respect to their cancers. What we know from 4,000 papers in the peer-reviewed literature is there are 4 major new diseases categories that the vaccines cause. This is proven in the peer-reviewed literature. The vaccines cause myocarditis or heart inflammation. That's proven. All the regulatory agencies agree. The Australian TGA agrees. Heart inflammation leads to cardiac arrest. That's proven in the peer-reviewed literature. So there's an epidemic of cardiac arrests among the vaccinated. And the next person who's perfectly well and has a cardiac arrest, the first thing that should come to mind is the COVID-19 vaccine. That's been shown time and time again. Even if inflammation is not detected by MRI or autopsy, it can be such a small patch as it can't be detected. We know now there's enough data to suggest the vaccine is the cause of the cardiac arrest. Vaccination accelerates atherosclerotic cardiovascular disease, raises blood pressures, been associated with aortic dissection, other cardiovascular disasters. The second major area is neurologic. The vaccines cause ischemic and thrombotic stroke. That's proven in the literature, agreed to by the regulatory agencies. The vaccines cause Guillain-Barré syndrome, a paralysis that can be fatal, small fiber neuropathy. They cause seizures, blindness, hearing loss, progression of neurodegenerative diseases. All of this now is supported in the literature. The third major area is the vaccines cause blood clots. They cause blood clots much worse than we've ever seen in medicine, blood clots extending from the ankle to the hip, published by the US FDA, Wuhan colleagues. Blood clots are highly resistant to blood thinners. So this has been very much a challenge. Every day in my practice, I'm dealing now with blood clots I've never seen before. And then the fourth major area is the vaccines can tip off autoimmunity. They can actually create syndromes where the body's own immune system attacks itself. These syndromes include what's called ANCA, anti-neutrophil cytoplasmic antibody positive vasculitis, renal failure, serious skin rashes, joint problems, problems that mimic diseases like systemic lupus and rheumatoid arthritis. So we check now a standard routine of 4 autoimmune panels in the vaccinated because we're worried about tripping off autoimmunity. Now, I've recently testified in the US Congress, and one of the questions I was asked is, how long do we have to worry about this? Our FDA guidance on genetic products, of which that's Pfizer, Moderna, AstraZeneca, and Janssen, says that the window of concern after taking a shot extends from 5 years at the minimum to 15 years. So we have 5 to 15 years of health worries now for those who took the jab. And that's just out of the U.S. Regulatory guidance. So patients, my recommendation is they stop taking any more vaccines. They get careful medical care from a doctor and a clinic that understands what's happened with these vaccines to get people as well through this as possible. People have asked, listen, how do we get the spike protein out of our body? I've led 2 papers in the peer-reviewed literature, the only ones that exist, Journal of American Physician and Surgeons, and now the Springer Nature Curious Biomedical Journal. And the protocol's called McCullough Protocol-Based Spike Protein Detoxification, largely so you can just remember me. And this calls for the use of 3 over-the-counter natural products, and you have them available in Australia. They are nattokinase, which is a product derived from the fermentation of soy. It's available in a capsule, 2,000 units twice a day. Bromelain, a family of enzymes derived from the stems of pineapples, 500 milligrams a day. And then curcumin, a spice derived from turmeric, 500 milligrams twice a day. And these are starting doses. We give it in between meals, and then we ramp up the dose in people with long COVID syndrome and vaccine injury syndrome. It's considered base because we add other drugs to it and other therapies to help people, get through these syndromes. Most people with long COVID have taken the vaccine. So in a sense, long COVID is de facto a post-vaccine syndrome. And we treat it the same way with detoxification. It's supported well from preclinical data, and then there have been some randomized trials with curcumin. Other things work. We use colchicine, a prescription medication if there's any pleural pericardial symptoms or myocarditis, corticosteroids if there's myocarditis as well. We use hydroxychloroquine in great quantities now for the autoimmune manifestations of this, standard blood thinners, sometimes at higher doses, plus the detoxification protocol for those with blood clots. And then everyone should understand so far the data are very positive with hyperbaric oxygen treatment. If there's hyperbaric centers in Australia, I imagine they're pretty busy right now. Anywhere from 6 to 40 sessions may be needed. We add other drugs in. We're finding good success, believe it or not, with using nicotine. A nicotine patch seems to interfere with the spike protein and the receptors, and one peer-reviewed study supporting it. We use a low-dose nicotine patch that seems to be safe. Other things we've tried, ivermectin for everyone, naltrexone, myravirac, We've tried a lot of things. They honestly don't appear to work. The Biden administration has put $1 billion in investigating long COVID. No new drugs, no new protocols, no new drugs or protocols from Australia either. So, follow me, follow those who are using their empiric skills in the art and science of medicine. I'm publishing everything I can to the best I can, despite the headwinds. I've seen thousands of patients, dealt with patients all today, as I will tomorrow. I'm doing everything I can to help people come through this pandemic. So join me in a call to remove all the COVID-19 vaccines from the market, seek justice. And we've heard some good news from Australia in the last few weeks about advances here in justice for what's happened. And then we have to move forward, potentially get ready for another pandemic. The same organizations that were behind the COVID-19 pandemic have been messaging strongly on disease X, potentially another version of COVID coming out of a biolab. And then there are many biolabs across the world. And we know the purpose of these viruses is to actually create a vaccine and have mass vaccination. Anthony Fauci, who testified in Congress just a few days ahead of me in January, finally admitted that the purpose of COVID-19 virus was actually for the vaccines. And that's what disease X is about. The same messaging occurred with COVID. Most of us weren't listening. We are listening, getting ready for disease X. Again, we start with the virucidal nasal sprays and washes, and certainly be ready with antibiotics to treat secondary bronchitis and pneumonia. I'm going to stop here and thank you for your attention. And hopefully we can get the system to work and I can answer some questions live.